Hi guys, welcome back to another video of your channel. So today we will be dealing with benign prostatic hyperplasia in canine. So if you haven't subscribed to our channel yet, feel free to subscribe and hit the bell icon for more updates. So canine benign prostatic hyperplasia. So benign hyperplasia or hypertrophy is mostly an age-related condition which is common in dogs after 5 years. Mostly the mean age at the diagnosis would be nearly 8.9 years. It is actually a benign enlargement of the prostate gland. So we know the only accessory sex gland in case of canine is prostate. So it is one of the most common canine prostatic affection or disorder. So this is not at all seen in castrated males. And this is actually due to the metabolization of testosterone. The 5-alpha dihydrotestosterone causes long-term exposure to the prostate and that lead to benign hyperplasia of the prostate. So this is actually a androgenic affection of the prostate gland. So you can see the normal prostate. So this is the prostatic urethra. So whenever there is an affection or an enlargement in the prostatic urethra, definitely there will be some problem affected with the normal urination. So you can see the enlarged prostate is compressing the prostatic urethra so that there will not be proper micturition and there will be urinary stasis inside the bladder, and that can also lead to cystitis along with prostatitis. So you can just see this is the bilobed prostate gland in case of dogs. So you can see this is the uh, prostatic urethral part through which the urine comes out. So whenever these glands get hypertrophied, what it can do is it can just compress the prostatic urethra. This is the anatomical positioning of the prostate and the prostatic urethra and the pelvic urethra and the urinary bladder. And you can also see if the prostate is enlarged, that can also compress the posterior colon and the rectum. So mainly the clinical signs will be polyuria, defecatory tenesmus because of the enlargement and the compression, and later it can lead to constipation. And upon rectal examination, we can easily palpate a non-painful swollen prostate, which is symmetrical and bilaterally enlarged. So most of the dogs will not be having that much palpable mass inside the rectum, but still you can see many other clinical signs such as hematuria because of the concurrent cystitis due to the urinary stasis and hemorrhagic discharge at the penile tip that is not at all related to the urination because of the prostatic cyst or intraprostatic cyst or the prostatitis. And also there will be tenesmus, constipation, altered stool shape that is mainly rubber ribbon like stools, and also the consistency will become very smooth and dysuria and bloody urethral discharge. These are the main clinical signs which is mainly correlated to the prostatic hypertrophy. So the age predisposition, it is a disease of mainly aged patients. So it mostly happens once they cross an age of 5 years, but there are reports where it's been published where a 2-year-old Doberman, a 3-year-old German Shepherd has been affected with the prostatic hyperplasia. The etiology is mainly because of 5-alpha dihydrotestosterone, or it's also called as DHT, which stimulates the glandular and cellular epithelium of the prostate and they get hypertrophied. So older intact dog have long-term exposure to DHT. So what happens exactly is older dogs secrete less testosterone and less DHT than the younger dogs. We know that. But they secrete, older dogs secrete more estradiol, and this estrogen sensitizes the prostate to the DHT. So the sensitization of the DHT to the prostate is much more in case of senile dogs. So pathogenesis, you can just read it out. It's just what is happening is it is compressing the prostatic urethra and also the colon and also lead to the clinical signs pertaining to the organ which it is compressing. So the biomarker, the reason biomarker which is mainly found in the BPH is prostate specific antigen test, that is PSA test. That is whenever the prostate gland is affected, they secrete certain level of markers which is called as prostate specific antigen. We can just estimate in the blood. So the must thing which you should have to do in case of a prostatic affection is always a urine analysis and the creatinine has to be estimated, serum biochemistry. Better to go for mainly creatinine. and also CBC to rule out concurrent cystitis and also prostatitis. Okay. And the diagnosis is mainly by clinical signs and history. So the first thing we have to get the clinical history from the owner in very detailed fashion. We have to ask about the defecatory pattern, defecatory habits, defecatory place, the urinary habits, urinary volume, the color, smell of urine, everything. And next will be physical examination, which is concurrent with the rectal examination. And also, in a detailed manner, we can also go ahead with ultrasound guided B mode FNSE and also USG examination. So this is actually a 5-alpha reductase inhibitor. So you can see testosterone is converted into dihydrotestosterone by an enzyme called as 5-alpha reductase. So what if we give a 5-alpha reductase inhibitor medicine? What happens is this efficacy of 5-alpha reductase comes down, so the testosterone will not be converted into dihydrotestosterone. So there is less dihydrotestosterone mediated glandular proliferation in the prostate. So the surgical protocol, which is correction, castration is the best method to resolve this issue. And the control and prevention is also castration. And the picture gallery you can see. So this is the prostate. You can see the prostate gland and the right lobe, left lobe. You can see the hyperechoic region of the prostate. In this video, I will be explaining the prostate gland affections mainly. So you can very well appreciate the ultrasound images of the prostate gland. So the both lobes you can appreciate very well. This is a case report where initially it was 57 millimeter the prostate affection in the day 0 presentation. The case was presented with the same clinical signs which was mentioned, and this is the FNAC. And you can see very well this was 5.7 centimeter, and later on oral finasteride therapy, it has reduced to 3.98 centimeter. Thank you.